It is a very isolated place. I think consequently Alaskans and our patients, experience high rates of substance abuse, depression, suicide, domestic violence, and those affect, the health outcomes of, everyone in the state and the patients that we serve. I think that has to serve as a backdrop for everything that we think about.
The Delta Center for a Thriving Safety Net is helping the Alaska Primary Care Association and the Alaska Behavioral Health Association find ways to advance policy and practice to make primary care and behavioral health systems more equitable and responsive to the unique needs of Alaskans.
In Alaska, even our urban centers are like only 20,000 people. We're remote, we're frontier. What is it? A third of our state has roads. The other 2/3 are you're flying in and out of.
The Delta Center initiative launched in 2018 with funding from the Robert Wood Johnson Foundation. JSI led a National Delta Center team, including strategic partners from the National Council for Mental Wellbeing, the National Association of Community Health Centers, and the Center for Accelerating Care Transformation. The goal was to advance policy change at the state and national levels and practice change among community health centers and community-based behavioral health organizations. Grantees use their Delta Center funding to support a broad array of policy activities, including background research, education and training, stakeholder engagement and convening, and building shared policy agendas.
And we were addressing, issues of mistrust, lack of understanding, a really lack of awareness and knowledge of the challenges that our different members were facing.
The Delta Center helped seed relationships that bloomed over time into powerful collaborations. Through funding by state associations and other sources, these collaborations led to significant policy victories and practice changes.
In places like Alaska, we are seeing primary care and behavioral health actually collaborate innovatively to solve the workforce crisis. Hearing how much in a frontier and rural space that Alaska can be, that actually doing work to provide job opportunities and more access to care together is this very sweet spot that Delta Center has been able to engender.
Through collaboration, the Alaska Delta Center team also worked on advancing new policies to implement telehealth.
People in Alaska saw it as a solution, an Alaskan solution, because there isn't the conversation of, you just have to drive farther to get somewhere. It's, this is the only way you do things. And so, as our healthcare organizations looked at how we do healthcare, telehealth has to be a part of it.
The Delta Center work also involved addressing health equity, where all residents have access to the care they need when they need it.
Probably about half of our member organizations are Alaska Native tribal health organizations, and that really drives a large component of our vision of equity, and that truly involves understanding and internalizing the sovereign status of those tribes.
John spoke to the strength and the vision that tribal health organizations have in our state, because they really are a strong voice for care for all of Alaska.
Ultimately, the Delta Center experience raised awareness of the need for collaboration across all sectors to achieve the holistic or whole person care that helps people address not just immediate concerns, but long-term quality of life.
If we can identify, sources of funding and support to do that with other sectors that might not necessarily see themselves as, aligned, it could be healthcare and behavioral health and housing, or food security, or childcare, so that we can understand the intersections and better learn how we can support one another and the communities that we serve. I think everyone could learn from that.